Citing latest data, experts confirm that the current COVID-19 wave in the country is the most severe one so far. To give us more details on this, Greg Gregorio joins us live from Antipolo. Good afternoon, Greg. I do understand that experts say we are already in the fourth wave of infections, and they're saying this is the most severe. What's the basis for that?
Well, Jess, good afternoon. We were able to talk to medical experts Dr. Rontgene Solante and Father Nicanor Austriaco, as well as data analytics expert Professor Jomar Bahante, whom both of these experts said that we are currently having the most severe wave of COVID-19 infection and also the longest wave of infection so far. For Dr. Rontgene Solante, he said we are seeing more cases than the previous waves of the COVID-19 infection in the country since the onset of the pandemic, which was back in March and April. We're also seeing more cases under age 50, and more healthcare workers are also having COVID-19 infection despite the vaccine coverage among healthcare workers. For Father Nicanor Austriaco, who is also an experimental biologist, he said the wave so far has been longer for about a week already than the third wave of infection, which was back in March to April early this year, which was previously driven by Alpha and Beta variant. But since the Department of Health is saying that we have not seen the peak of the fourth wave yet, or this current surge that we are seeing, Father Austriaco said we might be seeing even longer wave of infection than the previous waves. For Professor Rabahante, he said we are also seeing more cases, and hospital care utilization is still at an overwhelming state as compared to the previous waves. Jess?
Okay, now that they're saying that we are currently at the most severe and at the same time the longest wave of COVID infections, what do they recommend to at least curb this ongoing wave?
Charles, experts say while we are conducting a pilot run or an experimental intervention here in Metro Manila to address the ongoing surge of cases, they say we have to caution our decisions and emphasize our compliance to minimum public health standards, boosting our vaccine rollout, as for us not to revert the gains that we have gained in the past implementations of quarantine restrictions such as MECQ and ECQ in the past weeks and months. Jess?
All right, thank you very much for those updates. Again, Greg Gregorio reporting live from Antipolo.